Welcome to another edition of Healthy Living. I'm Aisha Salihu. Today we're going to do a quick review of some of the health challenges in the year 2021. I'm talking about disease outbreaks that almost rendered thousands of Nigerians scampering for safety and sent several others to their early graves. We'll take a look at where we are with these outbreaks and the way forward. I have with me in the studio a physician, Dr. Bright Oris, whose area of specialty is general medicine, to help us navigate. Welcome to the program, Doc.
Thank you very much.
2021 has been quite a year for the health sector. As you're well aware, the pandemic is still there, and then amidst other disease outbreaks. Yeah,
2021 was actually very packed, especially with the COVID-19 being at the top of the list. And 2021 actually gave us an idea of why health is actually very important, and not just in Nigeria, but across the world at large.
All right then. Let's begin with the latest COVID-19 update. As COVID-19 continues to spread, the higher the chances of more variants emerging. Since the onset of the pandemic, 4 variants of concern have been identified. The disease began with the Alpha and then Beta, Gamma, Delta and the Omicron variants respectively. With new cases recorded daily across the country, the infection toll from the virus in Nigeria has increased to over 240,000, while the death toll now stands at slightly over 3,000 cases. The Nigeria Center for Disease Control, NCDC, also revealed that over 213,000 Nigerians have been successfully treated and discharged nationwide, while over 23,000 people are still hospitalized. On Tuesday, 2nd March 2021, the National Primary Healthcare Development Agency announced the arrival of the expected COVAX, AstraZeneca and Oxford COVID-19 vaccines. The country went on to take deliveries of other vaccines like the Johnson & Johnson, Moderna, among others, while urging Nigerians to take the first, second and booster doses of these vaccines. However, on Thursday, 8 July 2021, the Nigerian government revealed that a case of the dangerous Delta variant has been recorded in a traveler in the country. Later on, with the emergence of the Omicron variant in November 2021 and the 500% increase in new COVID-19 infections, the country has moved from the 3rd to the 4th wave of the pandemic. The number of daily new COVID-19 cases worldwide has crossed 1 million for the first time since infections were first recorded 2 years ago. COVID-19 is still on the table. We're still talking about COVID-19,
yes,
especially now that we have over 500% increase in new infections recorded daily. What can you say about this?
Well, now here's a shocker. COVID-19 is here to stay, actually, because the virus has just been mutating from the Alpha, Beta, Gamma, Sigma, Delta, and then the Omicron variant of the virus. So I think we all have to accept that this virus is actually here to stay. And the earlier we start taking these measures to protect ourselves seriously, I think the better for us.
So you think it's because people are not taking the safety protocols and the guidelines seriously? That is why we have new infections, especially with the WHO saying the Delta variant and the Omicron variant, they are here and then they are causing increased cases. So what you think is because people are not taking this guidelines seriously?
Yes, I think even in countries where people were taking vaccinations, let's say seriously, for example, they still had a very increased rate, especially with this recent Omicron. Even with places that they had very strict vaccination, distancing, shutting down places, going out only when you really need to go out, using a mask and all that, they still recorded cases. So this thing is actually here to stay. Now, is it to alarm people? No, but it means that we should highlight these protective measures that are already in place because they work. What are these protective measures? Vaccination being at the top of the list. Get vaccinated, and then use the proper hand washing techniques, distancing, using a face mask, avoiding crowded places, going out only when you actually really need to go out, because then you reduce the spread of this virus. And then with the less spread, the less chances of other variants that might be even more deadly than the Delta variant come up.
But then why do we keep having variants coming up, and then you're talking about mutation of the variants, and how does this work? Yeah,
viruses learn. Viruses, that's just it. Viruses are intelligent. Let me just put it that way. They learn. So you put them in an environment and then they adapt. They adapt to accommodate that environment that you've put them in. So that is why we're seeing mutation from the alpha, beta, gamma, and the Delta and then the Omicron. So it's the viruses adapting to their environments. So that's why mutations happen. They're adapting. So for example, a person that doesn't take, let's say, the treatment properly, the virus adapts because you didn't put up sufficient fight against the virus. So they adapt to, and then they learn the technique of which are using to fight them, and then they adapt again, So that's why viruses adapt. They learn. When you put them in an environment, they adapt to the environment, and they modify themselves to be able to accommodate that environment that you've put them in.
Okay, you said viruses fight, and then you're talking about treatment now. Now let's go into vaccination. There's been, the vaccines are out there, and then NCDC is encouraging Nigerians to go out there and take these vaccines. But I'd like to ask very quickly, if these vaccines are there, and then how come we still have more infections? I thought vaccines were meant to somehow protect you from contracting a particular disease.
Well, yes, vaccines should help with that, but also vaccines reduce the, should I say, virulence of the virus when you're infected by it. So, for example, if the virus is normally supposed to be very fatal to you, but because you have some level of protection, so your body puts up a level of fight, which reduces, the virulence of that virus and the fatality that it can bring. So that is why people should actually take the vaccine. Some people have this idea that if I take the vaccine, I'll never get it again. But I read somewhere that somebody took all the doses and even took booster and still caught the variant, still caught the virus. So does it mean that vaccines are not helpful? No, that doesn't mean vaccines are not helpful. That means vaccines reduces. It's because of the invention of these vaccines that makes us quite comfortable going out. There's no longer these strict restrictions to movement because now the vaccine is helping us fight back. And I think people should embrace this. And the reason why, for example, in Nigeria, a lot of people are not taking it. Number one is knowledge. You don't know. Even the ones that know, they hear the conspiracy theories around the vaccines. So it stops them from actually going to take. And then there's also the availability of these vaccines in most people don't use social media. They don't watch TV. They don't listen to radio. So how do you get this message across to these people and explain to them in the language that they will understand? I think that is why we are having less vaccinations in Nigeria compared to other civilized countries.
So you feel the NCDC is using the media well enough to enlighten and inform the people about the vaccines and also the existence of the virus. But then I like to ask very quickly, I was on the streets and then I was asking some Nigerians about this COVID-19. Some people do not even believe it exists.
Yeah.
And then secondly, some persons will tell you, just like you said, there are some theories around these vaccines. So how do you think we can now mitigate this if you feel the media is doing enough, NCDC is doing enough, and yet people are still out there saying they need proof, they need evidence, they need to know, okay, yes, is there actually an existence of this disease? And if there is, we need to see these people, we need to see not just figures coming out from NCDC day in, day out.
Yeah, I think the mass media has done very well. In illuminating what the virus is, vaccines, the protective measures and all that. But I think that community-wide outreach from the grassroots will really help because let's be honest, more than, I don't know the statistics for sure, but more than 40% of Nigerians are illiterate. I mean, they don't know how to read, write, and properly understand what is being communicated in these mass medias. So how about we take people from these communities that really understand the message, what the virus is and the protective measures and the usefulness of vaccines. How about we take people from these communities and send them back to their own communities where they will talk to their neighbors, people who know, I know this person's house. I knew when this person was born, and this person is coming to tell me something about the virus and the vaccine and the importance of it. That person is more likely to listen to that person that came from the community than me wearing my big suits and going into their community, speaking one big English and telling them the kind of variants of the COVID-19 virus. No, they are going to listen to that person who speaks their language, who can communicate these things to them.
Okay, still talking about vaccines, we have the first dose, we have the second dose, and then we have the booster dose. I know about some diseases that you just have to take one vaccine for a lifetime. But this one, why are we taking up to 2 vaccines and then a booster dose?
The booster is usually recommended, but they'll tell you it's optional. The booster is not like if you take it and then you are protected for life and then you don't need to take again and all that. But it's just to strengthen your immunity, strengthen the defenses your body is putting up. So if you can't strengthen your defenses, why not? Hence the booster. The Moderna has booster, the Pfizer has booster, but the one that is prevalent in Nigeria now, the AstraZeneca, it does not have a booster. But you can't take the booster of either the Pfizer, Moderna, or Johnson & Johnson after you've taken AstraZeneca.
Okay, but do you think these vaccines are available in the communities? I mean, the rural areas. Like, I was also on the street, and then I hear from Nigerians a lot every day. And then they said some persons in the rural communities, they do not have access to these vaccines.
Yeah, I don't think these things are readily available in the rural communities. Now, first of all, how many primary care centers are in the rural communities to start with? Because if you want an outpost to give people these vaccines, you have to have a functional primary health care center. So how many primary care centers are in these places? Sometimes you see just 1, 2 primary care centers, serving a population of, thousands of people. So how do you expect them to come? First of all, even the primary care centers, most of them are not very active to start with. So how do you tell them to go there? So I think, first of all, we have to start with making the primary care centers functional. Then we can start, telling people, go to so-and-so primary care center and get your vaccine. Okay,
so we're still talking about COVID-19. And then I'd like to know very quickly, in 2022, I'm sure the pandemic is still going to be on, because right now we're being warned that perhaps there may be a lockdown if care is not taken, because we keep having spike in infections of COVID-19, and some persons are coming down with some symptoms, especially with this season now. You see people coming down with cough, catarrh, or maybe malaria, feverish conditions and all that. Can we still attribute these as symptoms of perhaps the Delta variant or the Omicron variant?
No, I think this will be the Omicron variant. Why? Because the Delta variant is, from the research and from the cases, has proved more fatal. But the Omicron variant so far says has the highest spread rate, but then comes down with not very serious fatal symptoms, as the Delta variant. So you have more cases, but less hospitalization.
Okay, but then what's the way forward in 2022?
Vaccination, being at the top of the list. So everybody should get a vaccine. For example, I talked with, now this is, I talked to my mom. My mom took her first jab. And I asked her, I told her, have you taken your vaccine? She said, yes, so I took. But, I've been hearing some things about this vaccine, so I've not taken the second one. I say, when did you take the first one? Say 3 months ago. I say, you see. Now, there are time stamps where you have to take the second jab, If she took AstraZeneca, she's supposed to take the second jab within 4 to 12 weeks of taking the first jab, But because of, conspiracy theories going around, things that the vaccine will cause this, it gives you symptoms, it affects fertility, it causes cancer, and people have, withdrawn from actually taking these vaccines. But vaccines remains at the top of the list come 2022.
Okay, but then the vaccines still do affect people. Some people come down with fever. Some people don't. After taking the vaccines, they come down with fever and all that. But I guess the conversation around COVID-19 is still going to be there and relevant. We'll have to keep talking about it, enlightening the public about the do's and the don'ts. We'll go on a quick break now, and when we return, we'll highlight other disease outbreaks in 2021. Stay with us.
Get latest updates on current topical issues and breaking news by downloading the TrustTV mobile app on your Android devices. Go online, click Google Play Store, search TrustTV, install the app, and get doses of unfiltered information on happenings all over the world in your pocket. TrustTV, documenting the Nigerian story.
If you're just joining in, this is Healthy Living on Trust TV, and we have been discussing some of the health challenges, disease outbreaks in 2021 and the way forward. Moving on to another disease outbreak in Nigeria, cholera is an endemic and seasonal disease occurring annually, mostly during the rainy season and more often in areas with poor sanitation. In the month of June, the Federal Capital Territory Administration placed residents of the territory on high alert following a reported outbreak of cholera, which claimed 7 lives with 91 suspected cases recorded at the time. The Nigeria Center for Disease Control, NCDC, said a total of 289 Nigerians had died from the disease between January and June 2021. As of November 21, 2021, the NCDC also disclosed that Nigeria has recorded a total of 3,566 deaths and 103,589 suspected cholera cases across 32 states of the Federation and the FCT, a 3.4% case fatality ratio. According to the center, 4 states, Bauchi, Jigawa, Kano and Zamfara, account for 55% of all cumulative cases. NCDC noted that cholera has claimed more lives in Nigeria than the dreaded coronavirus pandemic, especially in 2021. Cholera, we keep talking about cholera year in, year out, outbreaks, disease outbreaks. It's beginning to be tiring. And then cholera is here in 2021 again, and it doesn't look like it's going away. What are we doing wrong? How come these diseases keep coming back? What's the deal?
So the question is, which countries do you find things like cholera? Places of low socioeconomic status, poor water, poor drainage, these are the places. So if you're asking us, what are we doing wrong? Well, it's very obvious. What are we doing to get good water supply to rural communities? What are we doing to get good drainage to rural communities? Until we start from there, we're always going to fight cholera. We're always going to fight cholera. And also, the level of education as well. And this is where I go back to primary healthcare centers in the rural areas and communities. These are places where health talks come from. So if there are no health talks telling people how to manage, how to use water, what is clean and unclean water, how to purify their water, how to use which water to cook, which water to drink. Until we start from that, we're always going to battle with cholera, because these are the routes through which cholera is, infects people. Unclean water, basically, poor drainage, sewage systems. These are the areas where we have problems. So if we want to really fight cholera, let's start with creating and putting accessible, clean water and good drainage systems in communities.
Okay, what about vaccination? I'm aware cholera has, I think, a vaccination kit or something.
Yeah, well, I don't know how well people are using the cholera vaccine. I have very little information on the cholera vaccine so far, but I know there is treatment for it. There's antibacterial for the treatment of cholera, but the mainstay is prevention of cholera through healthy water consumption. If you can get that, you will not need vaccine to fight something.
Okay, but then if you're talking about healthy water consumption and all of that, what about communities that do not have access to water? Is it the fault of the community or the fault of the government in place in that community? So
the question is, whose responsibility is it to provide clean, healthy, drinkable water to communities? I think that's the fault of that person. In as much as the government has a huge role to play in this, I think that educating individuals on what cholera actually is, it goes a long way to help. Because even if individuals take it upon themselves to watch out for their own health, the number of cases of cholera would reduce, irrespective of government involvement or not. Government policies and providing these things for communities will actually help reduce the cases, that's for sure. But if individuals do not know the dangers that drinking unhealthy water poses to them, the results are not going to be as good as we want them to be.
So it is more of the burden is on the individuals in the community than the government?
Yeah, yes, both. Now, there are levels of health prevention, and the first one is educating these people what this disease is, and then there's a prevention, and the government cannot do its part and then the individual is not doing the part. Also, if the individual is doing their part, government also has to support, especially in cases like availability of clean water. Very few individuals can make clean water available to themselves. For example, places where they only have a stream as a water source in that community. So they all have to go to the stream. So how do we manage these things while we wait for these policies and the government to channel clean water to these places? What do we do in the meantime? We tell them, okay, this is how you make this water clean. This is how you purify it, for yourself, for your household. This is how you purify it to help protect yourself before you wait for. If you're going to let yourself catch cholera because government has not built something to provide clean water for you, well, you're actually, doing yourself a disservice.
Okay, this brings me back to where you talked about the primary healthcare centers. So these primary healthcare centers that are in the communities, first off, are they accessible? And then if they are accessible, are they affordable? If they are affordable, what about the medical practitioners we have there? Do they have enough hands? Do they have enough, say, medication? Perhaps so that when a community comes down with a disease outbreak, they know this is the primary health care we're running to, and then we know that when we get there, we'll get treated, and then we'll also get informed. The rest of the family would be informed that, okay, do not do this, do not do that. This is how you prevent yourself. What can you say about that?
Well, I think primary health care centers, I think they're not as available as they should be. So they're available. Talking about costs and prices, I think primary care centers are basically free. The services in primary care centers are free. The government takes care of the burden of providing free healthcare in primary healthcare centers, as far as my knowledge goes. But availability of medications and equipping these centers with staff, well, I think there's a lot of work that needs to be done in that area. Because sometimes you see a primary care center with 2 nurses and maybe a doctor, a doctor. In the primary care center. On
that note, do you see 2022 as a year without cholera outbreak?
No. There will still be cholera outbreak in 2022. In fact, it might be even more than the previous year. Why? Because number one, the healthcare staffs are reducing by the day. That's to start with. I've hardly seen any new development of building new and primary healthcare centers in communities. So until these things are put in place, there is no education of communities on these diseases, the outbreaks and the prevention. So yes, we're still going to see cholera outbreak in 2022.
We hope we don't. Lassa fever is a hemorrhagic illness whose presence is known in several West African countries. The virus is particularly present in Guinea, Sierra Leone, Liberia, and Nigeria. According to the World Health Organization, 80% of the people affected by the Lassa virus has no symptoms. The transmission to humans occurs by the exposure to food or items contaminated with urine or feces of infected rats. Historically, outbreaks occur during the dry season, that is from the period of November to May. However, in recent years, cases have also occurred during the rainy season. The Nigeria Center for Disease Control, NCDC, has reported 403 confirmed Lassa fever cases in 2021 through October 31. This includes 2 confirmed cases reported the last week of October. Of the 400+ confirmed cases, 79 resulted in death, accounting for a fatality rate of 19.6%. Now, we're still talking about Lassa fever. It's still here, and then the numbers are increasing. It's terrible.
This is even more terrible because it has affected healthcare practitioners, because when an infected person gets brought into the hospital, there's contact with that infected person. There's contact with the person's fluid, blood, and these are infected, So they infect even the healthcare practitioners as well. So few healthcare practitioners have actually gone as a result of Lassa fever, Lassa being hemorrhagic fever.
Okay, so on that note, we'll go on a quick break, and when we return, we'll discuss more disease outbreaks, and perhaps we'll take a look at some of the vaccines, the inventions that were made in 2021. Do stay with us.
Get latest updates on current topical issues and breaking news by downloading the TrustTV mobile app on your Android devices. Go online, click Google Play Store, search TrustTV, install the app, and get doses of unfiltered information on happenings all over the world in your pocket. TrustTV, documenting the Nigerian story.
If you're just joining in, this is Healthy Living on Trust TV, and we've been doing a lot. We've been talking about some of the disease outbreaks in 2021 and, of course, the way forward. Just before we went on that break, we were talking about Lassa fever, and Dr. Bright Oris is still here with us in the studio, and we have to talk more about Lassa fever. Of course, it's a conversation I believe it's going to be ongoing. We're not stopping it today. We keep having cases of Lassa fever, and then some persons are not even aware that these infected rats that contaminate the foods they eat, they don't even know that some rats are actually very harmful.
Yeah. You see some people, you've actually gone to the market to buy gari, and then you see rat feces in the gari. And then you're like, they'll just pick it up. So, not knowing that the rat has defecated, peed on that, and that becomes, infective. Until we learn rodent control, all these things, it will be hard to actually still contain Lassa, because you don't know which of these rats is carrying the virus or not. So rodent control should be the mainstay prevention method when it comes to this Lassa. And it goes back to socioeconomic status. Which places have you seen Lassa really, really been? People that have rats in their house, they see it as normal. They just buy a cat and that's it. So there's no real prevention against rodents. It's just one of those things. In fact, people say, there's rats in your house, there's rats in everybody's house, So it's not like we've learned to live with rats in our house, and it's not okay. People need to know that it's not okay.
But then how then do we know if, perhaps we have rats in our house, and then how then do we know if some of the food items we have in the house, if these foods have been contaminated, because maybe we may not even necessarily see the feces physically in the food?
No, proper storage to prevent rats from getting into your food. Proper storage. There are these plastic cans now that you can use to put your stuff. And if rats invade something that is stored properly, let's say you use cellophane, seal it properly, you will see the rat biting through it. And if you see that rat has bitten through this stuff, what should you do? Dispose it. Don't just rule it as, oh, no, it's okay. We don't know if the rat really... You are seeing the rat bite marks. And then after you notice that the rat is attacking my foodstuff, what do? You exterminate them. You find a way to fumigate your house against them and clean them again remove all the rats in there, put whatever you need to do. Use chemical fumigation if you must to remove these rats from your house.
But then you talked about rodent control, and then you mentioned chemical fumigation. This chemical fumigation and rodent control process and procedure, do you think it's something that is perhaps affordable? Because most of these cases of Lassa fever actually happen in the communities where people, I would like to say maybe downtrodden people, are not aware of fumigation, and perhaps they cannot afford it.
No, it's very affordable. I have hardly seen any rats control fumigation or chemical that is more than 1,000 naira. Even way less than that. I've actually seen very cheap. They're actually very, very affordable. So saying, oh, these are expensive methods, no, that's not an excuse. They are accessible and they are affordable. So there's no excuse.
What about transmission of the disease? You did talk about the fact that the Lassa fever is affecting more health workers. I read a story where some doctors in Nasarawa State, they got infected by a patient they were treating. How can we curb transmission?
Contact with the patient's body fluid. One of the symptoms of Lassa is, like we say, hemorrhagic fever. So there's bleeding from the orifices, the nose, mouth, ear sometimes. And so if you come in contact with that fluid, that blood, you might get infected. The high chance is very high if you do not follow precautionary measures after getting in contact with this person's body fluid, especially if the person has been confirmed to have a case of Lassa. Or even when you suspect hemorrhagic fever, the first thing you should do is make sure there is no contact with that person without adequate protective equipment.
We do hope that the case of Lassa fever is reduced in the year 2022. Now, moving on to an exciting discovery, the World Health Organization, WHO, is recommending widespread use of the RTS-SAS01 malaria vaccine among children in sub-Saharan Africa and in other regions with moderate to high falciparum malaria transmission. The recommendation is based on results from an ongoing pilot program in Ghana, Kenya and Malawi that has reached more than 800,000 children since 2019. This is a historic moment. The long-awaited malaria vaccine for children is a breakthrough for science, child health and malaria control, said the WHO Director General, Dr. Tedros Adhanom Ghebreyesus. Using these vaccines on top of existing tools to prevent malaria could save tens of thousands of young lives each year. Malaria remains a primary cause of childhood illnesses and death in sub-Saharan Africa. More than 260,000 African children under the age of 5 die from malaria annually. I'd like to say this is a good one. It's commendable.
Yeah. I think this malaria vaccine was I would say, one of my happiest moments in this, because last year I worked in a hospital not far from Abuja, and when it's rainy season, the pediatric ward is not enough. We start admitting kids in adult ward because there's simply no space, no bed space. It's not that there are not beds. They have a lot of beds, close to 40 beds, even more than 40 beds for just the pediatric department, But they are not even nearly as enough during this period because of malaria. And all the kids coming down with severe malaria, severe malaria, severe malaria. And a lot of them die too. So the invention of these malaria vaccine, I think it will go a very long way to help because, believe it or not, malaria has killed more people than even COVID. As even though COVID is at the top of the list for harmful, viruses, COVID is buzzing, but malaria kills more than COVID every season. In fact, even right now.
Speaking of, it reminds me of the interface I had with some Nigerians on the street because I go out on the street a lot. So, and then they were talking about, because I was asking questions on COVID-19, and then they said, how come we're neglecting malaria? Because malaria has been there for decades upon decades, and now the attention is more on COVID-19. But it's a good one now that there's an invention of the malaria vaccine. But my question to you is, if the vaccine is available now, perhaps I don't know if it has reached this part of the world, how accessible is this going to be, and is it even going to be affordable? And how soon are we going to see children taking these vaccines so that we don't have cases of malaria coming year in, year out?
I think one of the illnesses, diseases that a lot of finances has gone towards prevention, research is malaria. And Bill Gates and his wife do a lot of work too when it comes to malaria. So they put in billions of dollars. So accessibility, yes, I think it's going to be accessible. Affordable, I think it's going to be free. That's what I think. I think people will not need to pay for, because even right now, malaria treatment for children are free in government hospitals, in primary care centers. You don't pay for it. So how much more the vaccine to prevent even having the malaria in the first place, or to reduce the fatality of malaria? Of course, I think it's going to be accessible, free. But now we go back to primary health care centers. We go, these are the outpost points for people to go and take this vaccine. But how many are they? Are they functional? Until these places are functional, even the malaria vaccine, as much as we want every child to have it, very few are going to have access to it, not because of lack of interest, but availability of infrastructure to get it across to them.
Okay, so you're saying the malaria vaccines are more relevant when we're talking about malaria in children. What about the adults that come down with malaria? And then we keep talking about mosquito-treated nets. How many people have access to these mosquito-treated nets? How many people have access to clean environments just so we don't breed mosquitoes?
Yeah, also that. Now, the thing is, more children die from malaria than adults, so the fatality in children is way more. All through my work in in a government hospital, I've hardly seen, an adult that died from malaria, hardly. I didn't see all through, but I saw hundreds of children die from it. So there's no need to say why is the focus of malaria vaccine on children as opposed to on adults, because very few adults have fatalities from contacting malaria, very few.
Okay, we do hope that the fight against malaria is something that we're able to malaria is something we're able to someday say goodbye to, just so we don't keep having malaria infections day in, day out. And now on to another exciting news. A new life-saving drug, crizanlizumab, has been discovered in England to help people suffering from sickle cell disease. It is expected to be delivered through transfusion drip and works by binding to a protein in the blood cells to prevent the restriction of blood and oxygen supply that lead to a sickle cell crisis. Sickle cell disease is common in Africa, where up to 40% of a country's population can carry the mutated gene. The disease causes episodes of debilitating pain known as vaso-occlusive crisis. It could also cause infection, organ damage, acute chest syndrome, and stroke. Nigeria is considered the epicenter of the disease in the world. Now, there is a sickle cell new drug in the UK. And then how is this drug going to help people living with sickle cell disease? I
think after the malaria vaccine, the invention of this drug and actually putting it out for people to use is also one of the things I'm really, really excited about. Now, I had a patient last year. This was, I think, she was in her mid-30s, and she was pregnant. pregnant with, it was a twin gestation. She had twins, twin pregnancy. And she was a sickle cell warrior, And you could see how she fought and struggled, being pregnant with sickle cell. I've had to tend to a lot of sickle cell patients. And during that crisis period, even you as a doctor, you are going to feel the pain, because you see them in so much pain and you understand what they are going through. So saying a drug that can help reduce vaso-occlusive crisis and hospital admissions, that's a huge win. Now, even though we're going to advise people that are AS not to get married because of the chances of giving birth to a child with the sickle cell trait, sickle cell disease. But invention of this drug for people that already sickle cell, that already have the sickle cell, I think it's going to be very good. It's going to be very good for patients, and more so for the caregivers, the parents, and siblings, and guidance of these people with sickle cell. So yeah, I think this is a very huge development, and one which I think medical communities, especially those in these parts of the world, are very happy with.
So that means the drug is it a safer option than the bone marrow transplant?
The bone marrow transplant is a cure for sickle cell. But the drug helps to reduce hospital. The drug is not a cure. The drug is not a cure, but it helps reduce frequency of crisis and even how strongly the crisis will come. So that's a huge leap. Bone marrow remains the mainstay cure, sort of, for sickle cell disease. But this drug would help people who cannot even afford bone marrow transplant. Bone marrow transplant is very expensive, So it's not something you prescribe to every patient that comes. Go and do a bone marrow transplant, So it will make a lot of people have access to treatment, and this is a good treatment. Reducing hospital stay, reducing frequency of vaso-occlusive crisis, yeah, that's a win.
Okay, the problem I usually have with most of these inventions and discoveries of new drugs or vaccines is affordability and accessibility, especially to the third world countries, the developing countries, because most of these discoveries are made in Western countries, the developed countries. Then how soon are they going to come down to Africa or other developing countries, right? So how soon do you think these drugs, because like I said, sickle cell disease is prevalent in Nigeria. Perhaps there's been more awareness now for people not to marry, like you said, AS, and all that. Yeah. But this drug now, and perhaps any vaccine or any other invention, how do you think it's going to get down here, and then we have to start using them, and then it works for us?
Yeah, I think it's going to be available. Availability is something I think it's going to be available.
I think you're very positive about that. You keep saying it's going to be available.
Yes, I think it's going to be available because this is something that a lot of people have put in so much money and research into. And the aim for some of these things is not actually gain and not profit. For example, the malaria, the sickle cell, profit is not the aim for a lot of these inventions, especially with these particular drugs, because people who are affected by it are mostly, sometimes, people of lower socioeconomic status. So you cannot be making that drug with profit in mind for people of lower socioeconomic status, So I think profit is out of it. And even though there is a certain level of profit that people can make from it, I think there's going to be a very good substitute. For example, with sickle cell, there are lots of charitable foundations that take on sickle cell people in the research, taking care of them, footing their hospital bills. There's a lot of research that goes into it. For example, the hospital where I worked, if a sickle cell patient has almost free, or should I say subsidized, treatment whenever they have crisis in the hospital. So yeah, so availability, I think if it comes, I think it's going to be available to people. How soon it gets to Nigeria, that's something I cannot really say, especially since it's coming from the UK.
Okay, so we've been talking basically about disease outbreaks and some of the major health challenges in the year 2021. Now let's look at projections in 2022. Do you think Nigeria as a country, or Africa as a continent, do you think, or let's bring it down to Nigeria, do you think there'll be more disease outbreaks, or do you think we've learned, especially with the pandemic ongoing, do you think we've learned on how best to somehow prevent more disease outbreaks, just so we don't have it year in, year out?
No, I think this concept of 2022, it's making a lot of people, 2022 is tomorrow, it's tomorrow, So if policies and stuffs have not already been put on ground, for next week. There's no difference. So these things have to be put in place. We're looking at 2022 as if 2022 comes, the cloud is going to change, and no, 2022 is going to be an offspring of the plans that we have set in 2021. So the question is, what plans, what healthcare policies, what equipment, what method of propagating news, carrying out this information to people in rural places, in rural areas? Have we set a skeleton work for these things? Have we laid the groundwork for it? If we've not laid any groundwork for it, there's no structure that is going to automatically appear in 2022. But if we have laid groundwork in 2021, we will see the structure come up in 2022. So will there be more disease outbreaks in 2022? Definitely. But I think that with knowledge going far, I think some of these disease outbreaks will be better managed and more better managed, and measures would have been put in place, better measures, improved measures to combat some of these outbreaks.
Okay, you did talk about structures. That brings me to the fact that many Nigerian doctors now, or healthcare service providers, they see the opportunity to just go abroad, stay there, and then work from there instead of helping in Nigeria here. What can you really say about that? Because if we're talking about projection into 2022, and then we have more healthcare providers going abroad, seeking greener pastures, what hope do we have back in Nigeria? No,
you mentioned go abroad to work, and then when you refer to Nigeria, you said help. Why do we have to? Why is the word help? Is medicine a charitable work? That is one question you ask. Is it charitable?
But then you swore to an oath.
Yeah. So did the doctor in the US. So did the doctor in the UK. We also swore to an oath there. Now, the truth is, clinical medicine in Nigeria is painful. It's very painful. Very painful. And sometimes some people want to make it about the money for doctors. I've hardly seen, all the doctors I've met, I've had to pay for medications, treatments for patients one time or the other, sometimes consistently, So a lot of times it's not really about the money for us. If we are doing these things and we are seeing results, if control measures have been put in place, a lot of doctors will stay. But the structure is, should I say, dilapidated. It's crumbling. So there is no incentive for even doctors or healthcare workers to stay. There's poor remuneration, there is bad equipment, So imagine you give a doctor, he says, okay, treat people in this community. You arm him with nothing, and he keeps seeing people die. What do you think it does to his mental health? Why not go to a place where they have a good healthcare structure, where they have good insurance structure, where you hardly see people die from treatable things? Why not go there and relax, and just be away from the painful clinical practice in Nigeria? So who is not going to pick that? Anybody would pick that. Anybody would. I would. I will.
Okay. I guess on that exciting note, we would like to draw the curtains here, and a very big thank you to you for coming in to highlight some of these disease outbreaks and, of course, projections into 2022.
Thank you very much.
And we've been speaking to Dr. Bright Reese. Many thanks for staying with us on today's edition of Healthy Living. Do join us again on another edition of the program. For questions and comments, you can send a message to the social media handles displayed on your screen. Don't forget to follow and subscribe for more episodes of the program. I'm Aisha Salihu. Have a prosperous 2022.